right, now I'm going to move around to your back. I'm going to give you this cup of water. I'm going to check your thyroid gland, okay? So I'm going to touch your neck and I want you to drink a couple swallows of water. I'm just feeling your thyroid to make sure it's rising and dropping.
Okay.
Okay, go ahead. Okay. Okay, that's great. Now, can you move your neck from shoulder to shoulder and down chin to your chest and back, and then just roll your head. Okay, got good range of motion in your neck. I'm gonna go ahead and inspect your back. I'm gonna uncover you, the top half of you in the back, so that I can see good. I'm looking at the back for any rubor, for pallor, for any rashes, any lesions, wounds, the alignment of the spine. I want to look at the breathing pattern and whether she's using accessory muscles. Everything looks good, so I'm going to go ahead and palpate the paraspinal muscles of the upper and lower back. Everything feel okay?
Mm-hmm.
All right. Now I'm going to do some percussion. This won't hurt or anything. I'm just listening to the sound. Okay, sounds good. And I'm going to listen to your lungs sounds really quick, okay? If you could just breathe in and out for me, I'm going to start at the apex of your lungs. Okay, sounds good. Lungs are equal and clear bilaterally. I don't hear any adventitious sounds. Now I'm going to start with an inspection of your chest, okay? Can you turn to the side a little bit more? I'm sorry. That enough? Yeah, that's good. So I'm going to start with an inspection of the chest. I'm just looking for the same things as I was on the back: rubor, pallor, rashes, lesions, wounds, any lumps, anything like that. I don't notice anything that stands out. So I'm going to go ahead and palpate your anterior chest wall muscles. Just tell me if you feel any tenderness or pain anywhere. She feels tenderness and pain. Now I'm going to feel for the point of maximal impulse. Do you feel any pain there when I push?
No.
Okay, great. Next, I'm going to percuss your lung sounds. Great. Open right underneath your left breast, okay? All right, sounds good. Lungs are resonant. I'm going to listen to your lung sounds next. I'm going to start at the apex of the lungs. Just take a deep breath in and out for me. Sorry, actually through here. Go ahead. I'm going to go underneath your breast. Okay, and on this side. Okay, good. Now I'm going to listen to your heart sounds. I'm going to start over the aortic valve. I'm just listening for any murmurs. I'm going to start with the diaphragm. Listen to the aortic valve. And then the pulmonic valve. and then Erb's point. The mitral valve. And then I'm going to listen to the point of maximal impulse. And I'm going to listen for a minute here to get her apical pulse. And that is the mitral valve. I don't know if I said that. All right, now I'm going to listen with the bell. All right, we're going to start with the aortic. You're really good with it. Pulmonic. Erb's point. Good S1 and S2. The tricuspid. And the mitral, which is the point of maximal impulse. Okay, sounds good. Now I'm going to move to your arms. I'm going to lift your sleeves up so I can see your arms. I'm just going to inspect the skin. Again, I'm looking for rubor, pallor, any signs of cyanosis, any joints that look swollen, any skin lesions and wounds. There's a scar here. But the skin looks like it's the appropriate color. I'm looking at hair pattern distribution, looking at your fingers. I'm checking your capillary refill, which is less than 3 seconds. It's actually immediate. I'm going to check the range of motion of your fingers. Okay, does that feel good? Mm-hmm. And your wrist. And then can you bend your elbows for me? And can you hold your arms up and out? Roll your shoulders around. Okay, so you've got really good range of motion. I'm going to palpate your joints. Tell me if you feel any tenderness. In your elbows. No, and your wrist. And I'm going to check your joints of your fingers. Nothing? No. No pain. Okay, great. I'm going to check your brachial pulses. Those are good, 2+, and your radial pulses. Those are 2+ also. Can you grab my fingers? I'm just checking your strength, so I want you to squeeze my fingers as hard as you can. Okay, great. And now hold your arms like this. I'm going to push against your arms, push against me. Okay, great. And now do push against mine. All right, good job. Now I'm going to check your reflexes. Actually, before I check your reflexes, I want to check what's called graphesthesia. I'm going to use a couple different objects as well as just my finger. I want you to close your eyes. I'm going to trace something in your palm. Just tell me what it is, okay? Mm-hmm. A. Mm-hmm. I'm going to check this one. 2. Good job. Now I'm going to go ahead and place an object in your hand. Just close your palm and tell me what it is. Paperclip. Mm-hmm. Key. Mm-hmm. Coin. Okay, good job. Now let's check this one. Coin. Mm-hmm. Key. Paperclip. Good job. All right, now keep your eyes closed. I'm going to use something sharp and something dull, and I want you to tell me where you feel it and which one I'm using, okay? Dull. Okay. Dull. Where's that? On my lower left arm. Mm-hmm. Dull upper right arm. Mm-hmm. Dull lower right arm. Okay. Sharp upper right arm. Sharp lower right arm. Sharp upper left. Sharp lower left. All right, now I'm going to check it on your fingers too, okay? Tell me if you feel this with each finger. Yes. 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 Mm-hmm. Yes. All right, great. Now I'm going to check your reflexes, okay? Mm-hmm. First, I'm going to check your bicep reflexes here. Sorry. I'm going to support your arm. Just relax it. Okay. Okay. Now I'm going to check your tricep. All right, and your brachioradialis. Did it hurt? Okay, good. Strong. All right. Now just relax your arm. Okay. Check your tricep. And your brachioradialis. Okay, good job. All right, now I just want you to hold your arms out in front of you straight. Close your eyes. I'm just checking to see if you have any drift. We're going to hold them there for about 10 seconds. Okay, no pronator drift. All right, now keep your eyes shut, and I just want you to take one of your fingers and point it to your nose.
Touch my nose?
Yep. And then back out, and then do it with the other side. And then back out. Good job. Now I want you to put your hands, palms, on your thighs and just alternate them for me. Okay, did that really well. For the next portion of the exam, I'm going to have you lay down on the stretcher, and I will drape you. I'm going to pause the video while we do that, and then I'll restart it, okay? All right, now we have the camera and you are laying down. So I'm gonna go ahead and come here. I'm gonna put my gloves back on. Can I have you lay on your left side? I'm gonna have her lay in the left lateral decubitus position so that I can listen for mitral stenosis with my bell. All right, and if you can lay back on your back for me, I'm gonna have your head above, elevated 30 degrees so that I can check your JVP. Everything looks good. I'm going to inspect your chest for any obvious lesions or anything. Are you having any distress?
No.
You feel okay breathing? Don't feel uncomfortable like this?
No, I'm fine.
Okay, great. I'm going to just move the blanket here. There. We're just going to look at your abdomen, okay? So I'm just going to take a look at it first. I'm just observing for any spurs, any abnormal pulsations, and then I'm going to listen to it before I touch it because that's the best way to start with the abdomen. I'm going to start in the right lower quadrant, listening for vowel sounds. They're normal, active. Sounds good. Now I'm going to listen to the aortic artery. I'm listening for any bruits. Now I'm going to listen to the renal, and then the iliac, and then if it's okay with you, I'm going to palpate and listen to your femoral arteries.
Yes.
Okay, on both sides. Okay. Everything sounds good there. I'm going to go ahead and percuss your abdomen. And I'm going to percuss right underneath your right lower ribs. I'm just feeling for your liver, the edge of your liver. And that's about 8 centimeters. Okay, I'm going to start with some light palpation. Do you have any areas of pain?
No.
All right, so if you had any painful areas, I would just save those for last. But I'm just doing some light palpation. I don't feel anything abnormal. Everything okay?
Yes.
All right, now I'm going to do some deep palpation. Just let me know if anything feels tender. Everything okay?
Mm-hmm.
All right, now I'm going to go ahead and palpate your spleen. I'm going to put one hand underneath here to support your back. And then I want you to take a deep breath in. I'm going to palpate pretty deep on this, okay? Just let me know if you have any pain. You can breathe out. Okay, I was not able to palpate the spleen. Now I'm going to palpate your kidneys. So I'm going to put one hand underneath and one on top, and I'm going to try and capture the kidney in between. Can you breathe in for me? And then breathe out. Okay. And I'm going to check on this side. The same technique. Breathe in, and then breathe back out. Okay, I'm gonna cover you back up, and I'll move on to your legs, okay? Still see, yeah. First I'm going to palpate your popliteal pulses. They are 2+, equal bilaterally. Your dorsalis pedis pulses, posterior tibial pulses, and your dorsalis pedis pulses, and they are 2+. Looks good. I'm going to inspect the hips and the knees and the ankles and the feet. I'm looking at the toes for fungus. I'm looking for any calluses or corns. I'm looking for any ulcers on the bottom of the feet. I'm looking at the heels. I'm going to start with then I'm going to move to palpation. I'm palpating the heels and the ankles. Just let me know if you have any tenderness. I'm going to palpate the toes, heels, and then the knees. Everything feel okay?
Yes.
And then your hips. Does that feel okay? Any pain there?
No.
All right, good. I'm going to check your Babinski reflex on you. You can put your foot up here for me. Great. This might tickle or feel uncomfortable. Okay. Okay. And then I'm going to go ahead and do range of motion on you, okay?
Okay.
First, we're going to check the hips. So we're just moving that up. I'm going to move your leg to the inside and then rotate it out, okay? And then we're checking your knees. So you can pull them up here, extend them, and then can you just lift your legs straight up and back down. Now I'm going to do it but against resistance, okay? So just try to keep, there you go, good job. And then this way, great job. And then try to extend your leg out against me and try to pull your knee up. Great job. Let's do your other leg. Start with the hip. Does that feel okay?
Yes.
You're going to externally rotate and then come in. And then we're checking your knee to your chest. And then can you lift your leg straight up? And that feels okay?
Yes.
All right, let's try that against resistance, okay? I'm going to push. Great job. Now I'm going to pull. Good job. And then try to pull your knee up. I'm going to push against it. Now I'm going to check your feet. Just push your feet like you're pushing the gas pedal. Good job. And then pull your toes up to your nose. Great job. All right. So everything's been good with that. I'm going to have you sit up. I think I get you covered. I'm trying to drape you. All right, I'm going to move this chair and move the computer so that it can see. You can have a seat in this chair for me. Oh, turn it that way. And okay, good. Now I'm going to get my reflex camera back. All right, great. So I'm going to check your reflexes and your sensation, okay? So first tell me, I'm going to use sharp and dull. Close your eyes for me and tell me where it's located and if it's sharp or dull.
Sharp upper leg.
Okay?
Sharp upper right leg. Sharp right calf.
Mm-hmm.
Sharp left calf.
Yep.
Sharp bottom of foot.
Mm-hmm.
Sharp bottom of both foot.
I'm just going to touch your toes. Tell me each time you feel it, okay?
Yes. 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 Yes.
Okay, great job. Now I'm going to check your patellar reflexes. I'm going to support this leg. Okay, that was great. I'm going to do this leg. Okay. Now I'm going to check your Achilles tendon reflex. I'm just going to support the bottom of your foot here.
See that.
All right. Okay. And then I'm just gonna check for clonus while I'm here by pushing the foot forward and back out. And then this foot. Okay. All right, and I'm checking for clonus. No extra rigidity or movements there. Now I'm gonna have you stand up. Okay. All right, now I'm gonna move this chair. Good. Yeah, I'm gonna stand back here. I'm gonna inspect the spine, make sure it's in alignment. I'm gonna fix this camera. Okay, great. I'm gonna check the spine for alignment. I would have a gown that was open in the back so that I could look at it and inspect it. I'm gonna palpate it. Everything looks good. First thing I want you to do, I'm gonna help, I'm not gonna support you, but I'll be here for you in case you get dizzy, but I just want you to bend over and touch your toes, okay? Okay, good job. Now I'm gonna have you walk. I'm just looking for any foot drop, Trendelenburg gait, a waddling gait that would indicate hip dislocation or anything. So first I'm just gonna have you walk forward. If you feel dizzy at all, I'm here to support you. Great, now when you turn around, I'm gonna have you take a few steps on your heels. Good job, and then a few steps on your toes. Great job, you did good. This completes our exam today. You did a good job. You passed everything with flying colors. And I will see you at your next appointment. At this point, I would just clean the room and get everything ready for the next patient to be able to come in.